ear care specialist. I specialise in the diagnosis, treatment and rehabilitation of people suffering from hearing loss and balance disorders. In addition, as a clinical ear care specialist, I also specialise in the removal of foreign bodies, impacted earwax, infected discharge and infected debris from the ear canal. We have a client here who attended a couple of weeks ago, and this is a pre-examination video. The first one was his left ear and this is his right ear. Started the procedure in the left ear. The client is a chronic earwax sufferer. He has to attend every 3 to 4 months to have his earwax removed. You can see the earwax is quite dry. I've just gone in with the Zollner suction probe, but just at the entrance there's a few cilia. So these cilia, these hairs, do have a function. They're designed to help filtrate some of the air that enters the ear, but also more importantly to collect any dust or pollen or foreign particles that enter the ear. Male people often get more cilia than females, and as we get older we generally tend to have more cilia hairs, both in the entrance of the ear canals and also in the nostrils. These hairs are typically found on the outer third of the ear canal. So the outer third of the ear canal is composed of cartilage and a thicker layer of skin, which is about 1 millimeter thick, and the inner 2/3 of the ear canal is made up of a very thin layer of skin, 0.1 millimeter, so 1/10 of the thickness of the skin that lines the outer third, and that very thin layer of skin is literally coating the bony part of the ear canal, which is very sensitive. So the hair follicles are normally found on the outer third only. You can see there it is quite stubborn wax, quite dry, just wriggling it around. The earwax is fully occluding the gentleman's ear canal, so it's right from the entrance all the way to the eardrum, which is approximately 3 centimeters in depth. Got a bit of dry wax there stuck to the Zollner suction probe, so I've just come out, cleared that. In a moment I am going to be using some drops. When you perform the procedure, sometimes you feel, I won't need to use the drops because the wax is being extracted. You can see there I'm beginning to loosen the plug of wax. You can see deeper into the ear canal on the right hand side. You can see the posterior ear canal wall. So we are segregating the wax from the canal, and quite often this is the time where you put drops in, so the drops can seep around the wax, coat the wax, lubricate it off the canal wall. See, so it is very dry in there. I think I'm going to be going in a moment with some olive oil spray. So I tend to use ear roll. Ear roll is a specially formulated olive oil for safe use in the ear. It comes in a spray applicator. It is a class 1 medical device. You can get that from over the counter. We should also be stocking that soon on our Clearwax website, so it will be available to the public, and we'll have some other products as well for the general public, some general ear care products, and I will let you guys know when we launch that. We have some very exciting news as well with regards to Clearwax. So I own 2 companies, the Hair Clinic, which is my own company. That's where I do my day-to-day treatments for patients, and I'm also a director of a second company called Clearwax. So Clearwax is the company that I co-founded back in 2015, and we developed the iClearScope endoscope, the wireless endoscope, which I'm using right now to visualize the ear. We also train ear professionals, not only in the UK, but from all around the world. Obviously that's a bit difficult at the moment due to COVID. So we offer specialist training in endoscopic earwax removal, and it's myself, we've got an ENT consultant surgeon, Mr. Darish Rajali, and my other colleague, Mr. Kaz Shiraz, who's also a consultant audiologist like myself. You can visit our website, www.clearwax.co.uk, and if you're an ear professional interested in being trained in endoscopic earwax removal, there's a training portal there. Please do have a look. You see the olive oil has helped, it's lubricated the wax, I've got a better suction grip, still a bit of a tug of war here, we're just at the entrance, we know that because of the hairs. And you can also see the ear canal shape, it funnels inwards, so when we're in that funneling bit there, that's at the entrance. I've got the lateral piece of earwax out, just going deeper in now. We've got some wax stuck to the anterior canal wall, laterally, sorry. So the anterior means the the front part of the ear canal. So in the case of the left ear, it's on the left hand side of the ear canal, and lateral means near the entrance. So we just loosened that, and the plug of wax came out in one big piece. See the tympanic membrane in the distance. You can see there he has had previous surgery to his ears. He suffers from glue ear. So glue ear is a buildup of fluid, middle ear effusion behind the eardrum due to typically a blocked eustachian tube. And he's had grommets in the past. So a grommet is a ventilation tube that is surgically inserted through the eardrum. The surgeon uses a scalpel to pierce the eardrum, suction out all that fluid, which turns into a glue substance, hence the name glue ear. And to prevent it reoccurring, they then insert a ventilation tube so air can enter the middle ear via the ear canal, as opposed to the back of the nose, where it typically does via the eustachian tube. You can see, however, the eardrum is slightly dull in appearance. It is also slightly retracted. So when we say retracted, the eardrum is buckled inwards because the eustachian tube behind the eardrum that connects to the back of the nose, the nasopharynx, is blocked. It creates a vacuum, there's no air there, so the eardrum gets pulled inwards. This patient also, as well as suffering from chronic earwax impaction, also suffers from chronic eustachian tube dysfunction and glue ear. We've recommended some over-the-counter nasal decongestion spray, trying to unblock that eustachian tube at the back of the nose so fluid can drain away and air can enter the middle ear and pop the eardrum back out. We've also recommended the ear popper and the Otovent nasal balloon, which are both non-surgical devices designed to help fluid drain out of the eustachian tube. The patient is already under review with the GP and ENT because he has got a history of glue ear. So we successfully removed the wax from the left ear, and this is the right ear. This is where that big plug of wax that looks like a cigar or sausage, the one in the thumbnail, was removed in. Again, bit of hair at the entrance there. People often say, why don't you trim it? Well, I explained at the beginning of the video, and also as a healthcare professional, we only do things that are absolutely necessary. It's not, I know as a viewer, it may be slightly obscuring the view, but it's not affecting me in my job and what I'm doing. So this wax, we didn't have to use any drops, got a good suction grip, and in a moment you'll see the whole plug of wax removed in one single large piece. I did forget to measure this piece of wax, but it was extending right from the ear canal to the eardrum, so we're looking in excess of 2.5 centimeters in length, and there we have it. You'll see some great still images, just like the thumbnail. The wax has been removed, and again, although there's no the patient did also have a grommet fitted in this ear, but it's healed very well. You can't see where the grommet was previously inserted, but similarly to the left eardrum, the left tympanic membrane, the eardrum on this side is also a bit dull, it's slightly inflamed, and the handle of malleus, the hammer bone, you can see it's more of a horizontal plane, which can often happen when the eardrum sucked in, and there is a bit of an attic retraction. So the attic is the top part of the eardrum. More specifically, it's the superior posterior quadrants of the top left hand side. In the case of the right ear, it is a bit of a buckling inwards, just using a Jobson horn just to remove some of this soft dry wax at the entrance. You may have also noticed the colour was a bit darker, and that's just because the client is Asian in ethnicity, and you do get a bit of a duller view with the endoscope or any visualization technique, and you can just see there. But otherwise, his symptoms have significantly improved, and you can see on this still image the aging of the wax. On the right, well, on that previous still image, you can see the lighter shade of grey, and as it goes further in, it's darker. So that darker wax has been in there for longer. The wax near the entrance is the lighter shade of grey, and in a moment you're going to have a still image of all the contents on both ears. I hope you enjoyed that video, guys. I hope wherever you are in the world, it's nice and warm. In the UK, it's pretty cold today, so we're gearing up for winter. And finally, I hope you're all keeping well and safe. Thank you. Bye.